Hi, I'm Jennifer Stewart and I'm here to talk to you about a condition which is quite common in horses in Australia, and it's known as bighead. Bighead's been described for centuries, and the reason it got the name bighead is because horses have a big head if they're affected by it. I think the really important thing is though that bighead is a sign of another disease. It's not a disease on its own, it's a sign of osteoporosis. Now, osteoporosis means demineralisation of the whole skeleton. The reason we see signs in the head is because it can affect the mandible and maxilla, and then the mineralised bone is replaced with soft fibrous tissue. So it's really important though that if you have a horse with big head, then to know that the whole skeleton is osteoporotic. The difficulty with this disease is that probably only about 10% of horses with osteoporosis actually progress to the stage of big head. Big head's the end stage of the disease. It's usually seen in younger horses, and it doesn't usually show up for several months. But the whole skeleton is affected with osteoporosis. So we need to think of osteoporosis, and big head is one of the signs of osteoporosis. It's not a disease in itself. The disease state is osteoporosis. So what are the other signs? Because this disease is so widespread, and when I was in equine practice as a veterinarian, we had a lot of horses that were grazing pastures high in oxalates, and we had lots of big head. But we also had a higher incidence of fractures, tendon problems, mares fracturing pelvises after foaling, a lot of clinical things, that spontaneous fractures in the paddock and other things that seemed unassociated and were always a cause for concern because we couldn't find out the cause. And what the problem is with osteoporosis is because it affects every bone in the body, you can see a lot of different signs. The horse may just have problems chewing. It might have a unilateral nasal discharge. It might make a noise when it's breathing. It might have an intermittent lameness that comes and goes, also known as a shifting lameness. It can also have, we also see a higher incidence of ligament and tendon problems, joint pain, and unfortunately spontaneous fractures. So there's a lot of signs that a horse has osteoporosis. One of the signs is big head, and unfortunately the signs aren't always present, and so we're missing a lot of horses that have osteoporosis and only discovering it when they have some sort of an injury or accident. The difficulty with osteoporosis is, just as in humans, it's very difficult to diagnose. The options are a blood test, but remember, osteoporosis is a demineralisation, low calcium levels in the bones, not the blood. So a blood test tells us nothing about the state of the bones, and that's the same in humans. The other thing we can do is take simultaneous blood and urine tests, which we can measure certain things and get what's known as the fractional excretion ratio. Unfortunately, the blood and urine must be collected simultaneously. We have to collect the entire contents of the bladder, which means usually passing a catheter. And we also need the urine in the bladder to be well mixed, so the horse has to be exercised fairly intensely to mix up all the sediment. So that's another difficult one. We can also do x-rays, and sometimes we can see changes in bone density with x-rays. Again, as in humans, it's not really diagnostic and you miss a lot of cases. The other thing we can do is measure parathyroid hormone, and the role of parathyroid hormone is to move calcium that's stored in the bones up into the blood to keep the blood levels normal, because they've got to be tightly regulated. Blood calcium levels can affect heartbeat, muscle contraction, nerve function, so the blood calcium levels are critically important. Parathyroid hormone releases calcium from the bones if the blood levels are low. So we can measure parathyroid hormone. There are some tests available, but they haven't been validated for horses. The other thing is that the parathyroid hormone is quite unstable, so the blood's got to be collected, it's got to be go into a refrigerated centrifuge almost immediately, and then the supinate and frozen for analysis. and we don't have a laboratory in Australia at the moment that can do that. The final and only way to diagnose osteoporosis is with a bone biopsy. And there are some places that will look at the biopsies of the bone and give an assessment of the mineralisation of the skeleton. So if you see a horse with big head, it's just the tip of the iceberg. And if you see a horse with big head, think generalised skeletal osteoporosis. And also, if the horses are at risk, if they're young or grazing oxalate pastures, then they're more, I think you can assume most of them are going to have some degree of osteoporosis, and we don't want to miss them. We don't want to just become aware of them when they have an injury or a fracture, or they've got an intermittent lameness. So it's important to be aware that big head equals osteoporosis.